This is Carol Bradley, RN, calling from the emergency department. I have a new admission for 5 South. The patient is Joseph Rogers, 6-month-old infant with a diagnosis of RSV bronchiolitis. Background: Joseph presented a 6-month-old infant weighing 6.4 kilograms. He came to the emergency room at 0700 with a history of runny nose for 3 days, warm to touch, and noisy breathing that got worse overnight, as per his mother. Mother also reports poor feeding yesterday and today and decrease in number of wet diapers. His past medical history: infant was a vaginal delivery, full term with no complications, no history of respiratory illness, but has had mild eczema since birth. No known allergies to medications or foods. Immunizations are up to date. Social history: infant lives with both parents. Father does report that he smokes cigarettes outside the home. Patient and his 3-year-old sibling attend daycare. Developmentally: mother says baby is developing normally. He's sitting up on his own, babbling, and has some slight stranger anxiety. His initial emergency room assessment findings were his temp was 38 degrees centigrade axillary, 37.8 centigrade rectally. Respiratory rate 80 and slightly irregular. Apical pulse 150 in normal sinus rhythm. His blood pressure 70/50, taken on right lower extremity. Oxygen saturation 89% on room air. His breath sounds auscultated bilaterally. Expiratory wheezes. Also noted some mild work of breathing. Moderate substernal and subcostal retractions and dry cough. Anterior fontanelle slightly depressed. Peripheral pulses strong and cap refill less than 2 seconds. FLAC score is a 1, crying but consolable by mom. Interventions in the emergency room: oxygen via nasal cannula to maintain saturation above 93%. He had a bolus given over 2 hours in the emergency room. Frequent bowl suctioning and nares with saline nose drops. He tolerated 3 ounces of formula at 0800, and he had a bolus of the IV fluids, 100 milliliters, given at 0900. He had a rapid RSV, and it did test positive. Current assessment of the patient prior to transfer at 10:30. His head, ears, eyes, nose, and throat were negative for nasal flaring, positive for dry cough, positive for nasal congestion, also dry mucous membranes. Neuro: patient is awake but agitated, but is consolable by mom. Pupils are equal and reactive to light. Anterior fontanelle is slightly depressed. Current assessment of respiratory status: his resp rate is 84, O2 saturation 93 to 94% on 1 liter of oxygen. He's got work on breathing, has decreased with no nasal flaring. You can still auscultate expiratory wheezes as well as slightly decreased breath sounds in the right lower lung. His CV: patient pale, negative for cyanosis, peripheral pulses, strong +3. Cap refill is less than 2 seconds. Apical rate is 90 and regular. His abdomen is soft, non-distended, and non-tender. There are slightly increased bowel signs in all 4 quadrants. His last BM was yesterday, and it was loose. GU: there was a wet diaper at 0930 of approximately 60 cc's of clear yellow urine. He has not had any more formula since 0800. Musculoskeleton: he's moving all 4 quadrants easily. His skin is clear with mild eczema noted on his right arm. His peripheral IV lock is in place with no complications. Recommendations: do a complete physical assessment of this new admission. Focus on vital signs, respiratory status, neuro status, and hydration status. Do you have any other questions about this patient? Come in.
Hi, my name is Jen. I'm going to be the nurse with your son today.
Oh, okay.
Are you mom?
I am mom, yes.
And what should I call you?
Sharon is fine.
Sharon, hi. I'm wearing this gown because it's hospital policy for the RSV that your son was diagnosed with, just as contact precautions so we don't spread it around to the other kids, okay?
Oh, okay.
Right now I'm just going to do a safety check. First, I'm just going to check the railings on the side of the bed. When we're not in the room, or you're not in the room, we want the railings all the way up. But when you're in the room, or when we're in the room, we can have them lowered a little bit, as long as we're right next to the bedside, just in case he rolls.
Okay, right.
Okay.
I have to remember that.
Okay.
Okay, perfect. I'm just going to check his oxygen. It's on 1 liter per minute, which is where it should be.
Okay.
All the tubing is untangled, which is great. Just going to check the suction. Great. There's an ambu bag beside the bed with the appropriate face mask. And this is Joseph Rogers, MRN 123456. And that is what I have. Is this Joseph?
Yes.
Okay, good.
Mhm.
And what's his birthday?
1/10/14.
Great, thank you. And I'm just going to check the IV site.
Okay.
Everything looks good. It's dry and intact. And that should be all set. All right, I'm just going to put on some gloves.
Okay.
How do you think he was doing last night, Mom?
Well, last night he was really bad. It was scary, but I feel like he's doing a lot better.
Okay.
He's still squirmy and restless, but I can settle him down now. So, I think that's a big improvement.
Okay, so based on the restlessness and consolable only by you, I'm going to give him a FLAC scale of 2.
Okay.
I'm just going to look at his vital signs, make sure they're normal, look at his work of breathing a little bit because he is coming in with that respiratory problem. Is that okay?
Right. Okay, great. Yeah.
First, I'm just going to lift up his gown to look at his stomach to count his respirations.
Okay.
I'm going to get on his level and then count his respirations for an entire minute. All right, great. So his respirations are 70 breaths per minute, and I'm noticing slight retractions between his ribs, which means that Joseph's working a little bit harder to breathe, which we would kind of be expecting.
Okay.
Right now, I'm going to listen to his lungs a little bit, see if there's any gunk in there, and if there is, then we can work on suctioning it out.
Oh, good.
Okay.
All right.
And now, he sounds a little junky in the front, but I'm going to check the back as well.
Oh, okay.
But while I'm here, I'm just going to listen to his apical heart rate for a full minute,
Oh, okay.
just so we don't have to move him too much.
All right.
Okay, great. I got 117 as a heart rate.
Okay. Okay.
And so I'm just going to take a look at his other vital signs really quick.
Oh, all right.
So his SpO2 is 90, so that's a little lower than we'd like. I did hear some little crackles in his lungs, which probably just means he has some fluid in there,
Oh,
which
okay.
we're expecting. I'm going to listen to his backside too, but I just want to make sure that I get his other vital signs first before we pick him up and really disturb him.
Oh, good. Okay.
I'm just going to put the blood pressure cuff on really quick.
All right.
All right, great. His blood pressure is 90/51, which is normal.
All right.
And his temperature really quick.
Okay.
And his temperature is 38.4, which means he has a little bit of a fever right now.
Oh, okay.
Okay. All right, so if you wouldn't mind helping me, I'm just going to
Sure.
lift him up so we can listen to the back.
Okay. Okay, sweetie.
Perfect.
All right.
Thank you.
Mm-hmm.
You're doing a great job, bud. Keep it going.
Yeah. Okay, honey.
All right, I'm just going to take a listen to the back.
Okay.
Okay.
Okay, should I put him down?
That would be perfect. Thank
All
you.
right.
All right. So as I said before, he does have some junk in his lungs, so we are going to suction him. His SpO2 is a little lower than we'd normally like it, so we're
Okay.
going to do some nasopharyngeal suctioning, so we're going to go through his nose.
Okay.
The first thing, okay, so right now I'm just going to suction him like we talked about, get out some of that mucus.
Oh, okay. Yeah.
So I've got this all connected,
Okay.
and I'm just going to turn it on.
All right.
Now we can take.
Okay.
There we go.
Okay.
All right, here we go, bud.
Oh, gosh. There is a lot of junk coming out of there. Oh, wow. That's a lot of stuff. Junk. You must feel better, I hope.
So hopefully that'll make him
Yeah.
a little bit better.
That's great. Okay.
Let's put the oxygen back on
Okay.
so you can get some air. And then we'll do a reassessment to see how that suctioning helped.
Oh, okay, good.
All right, so now I'm going to reassess Joseph here.
Okay.
Do you think he looks a little bit better? I think he looks a little bit
I
calmer.
think he looks calmer, yes, and I think he's definitely a little bit better. Yeah.
Okay. I'm just going to check his breathing again and see
Okay.
if there was any positive effect of the suctioning.
Okay.
So once again, I'm going to look at his belly and count his respirations for 1 minute.
Mm-hmm.
Alright, and from what I'm seeing, the retractions around his ribs are a little bit less,
Oh,
and
good.
his respirations have lowered. They're about 62 now.
Okay.
And so it means his work of breathing is a little bit less. So that means to me that the suctioning has done some good.
Okay.
I can see that his SpO2 is now up to 95, which is wonderful.
Okay.
We're trying to keep that really between 93 and 100.
Oh, okay.
Okay, so I'm just going to take a listen. We'll see if any of that junk that I heard earlier has gone out a little bit.
Good.
It sounds a little bit more clear in the front. Would you mind helping me lift him up again?
Oh, sure, absolutely.
Thank you.
Okay, honey.
Great. Doing a great job. Okay, good.
Okay, check one down.
If you can just leave him up for a sec, that would be good.
Okay.
Just gonna. His lungs sound clear to me.
Oh, good.
So I think the suctioning really did help.
Yeah.
And
I think so too. Yeah.
I think he seems a little bit calmer.
Yeah.
What would your assessment be of him?
No,
at the
I
moment?
definitely think he's a little bit calmer. You know, he's definitely not as squirmy and restless
Good.
as he had been.
Good. All right, so I'm just going to check his anterior fontanelle. It's a little depressed, which we would expect because he's a little dehydrated because of everything that's been going on with his respiratory tract. But we'll just keep an eye on it. If we
Okay.
need to give fluids, we can.
Okay.
So it's something we're just going to watch for right now.
Okay.
Okay, we can lean him back down.
Lean back?
Yeah.
Okay. All right.
Good.
Okay.
All right, so I'm just going to check his pulses right now.
Mm-hmm.
Check for capillary refill. Looks good, less than 2 seconds. Check for capillary refill. Good, also less than 2 seconds.
Okay.
I'm just gonna come. When was the last time he had a bowel movement?
Yesterday morning.
Yesterday morning? Okay. And when was the last time he had a wet diaper?
Oh gosh, I don't even know if he's had one yet.
Okay.
I don't know.
All right. I'm just gonna check it to see if there's any diaper rash. Oh, everything looks good.
Okay.
Alright. So has he been feeding well?
Well, I just
If you could leave that up,
Oh,
just
sorry.
listen to his belly. That's okay.
Yesterday when we came to the emergency room, they let me give him a little bit
A formula.
Yeah, and that's it.
Okay. All right. I'm gonna look first. Abdomen seems round. Good color. Looks normal. All right. Now I'm just gonna take a little listen.
Okay.
Bowel sounds are hypoactive, which is what we'd expect if he hadn't been eating in a while.
Okay.
I'm just going to palpate. Good. No tenderness, no masses, no distension.
Mm-hmm.
Okay, good. I'm just going to take a look at his skin really quick.
Okay.
That's really the last thing in my assessment. I see that he has a little eczema on his arm here. Has that always been there?
Yeah.
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 Okay. All right, good. So I'll just make a note on that in the chart.
Okay.
All right, Mom. Well, that's all I have for my assessment right now.
Okay.
My main concerns right now are his temperature and the fact that he hasn't had a wet diaper since he's been here.
Okay.
So I'm going to call the doctor, just give him an update, let him know what's been going on, let him know what I'm seeing, and he'll give me more instructions from there, and then I'll come right back to you, and we can talk about what he said.
Oh, great. Thank
Okay.
you.
All right. Thank you. I'm just going to raise this up.
Oh, okay.
All right.
Okay.
And I'll be right back.
Okay.
Hi, my name is Jennifer Bubb. I'm the nurse working with Joseph Rogers on 5 South. He is a 6-month-old infant that was admitted to the ER yesterday with a diagnosis of RSV and bronchiolitis.
Oh, yes, I remember him. Yeah.
So I met the patient this morning, and his mom said that he was doing better than last night. She still said that he seemed a little restless, but he was consolable by her. I did my physical assessment, and I found that his lung sounds were very congested and junky. I looked at the pulse ox, and it was 90. His respiration rate was 70, and his heart rate was 117. So I decided to suction him, and after suctioning, his oxygen saturation went back up to 95, his work of breathing went down, and his respiratory rate also went down. So he seemed better. My concern right now is that his temperature is 38.4, and he has not had a wet diaper since he arrived at the hospital. Would you like me to get an order for the temperature?
Yeah, thanks for calling me. What's his weight again?
He's 6.4 kilograms.
Great. Okay, so I'm going to give you an order for acetaminophen,
Okay.
96 milligrams PO, every 4 to 6 hours for a temp over 38.2 degrees Celsius.
Okay, I'm just going to read that back to you. I have a verbal order for acetaminophen, 96 milligrams PO, every 4 to 6 hours for a temperature over 38.2 degrees Celsius.
That's great, thank you. And you know what, I'm going to come down in a little bit to make my rounds. We gave him a fluid bolus in the emergency department, so after I see him, maybe we can start getting him some PO intake, maybe let the mom give him a bottle. So, thank you.
Okay, great, thank you. Bye. Okay, so now I'm going to look up in the formulary just to make sure that the medication ordered is a safe dose for this patient. So I'm going to look up acetaminophen, which is an antipyretic. The safe dose for this patient is 10 to 15 milligrams per kilogram since he is over 5 months old. Great. And I do my calculations out. The dose that I was given is within the therapeutic range, so I am all set to give the medication. Come over to the Peds and look at my patient. What I found here is Joseph, which is the patient. MRN number 123456. I have 3 milliliters of acetaminophen, which is correct since the dose is 160 milligrams per 5 milliliters. So there is 96 milligrams in 3 milliliters. So I have an oral dose. I need it now since his temperature is over 38.4. I have the right patient, I have the right route, I have the right dose, I have the right time, and I'll have the right documentation. That's all set. I'm logging out. I'll log out of the formulary. All right. Hi.
Hi.
I'm back.
Oh, good.
How you doing?
Good, much better.
Okay,
Yeah. Mhm.
good. So I gave the doc a call, and he gave me an order for some Tylenol or acetaminophen.
Oh, okay.
Has Joseph had that before?
Yes, he has.
Okay, good. So there's no allergies that I need to be concerned about?
No.
Okay, great. So the doctor also said that he is going to be down soon, and then they'll come in, see Joseph, talk to
Okay.
you,
Good.
make a plan from here.
Great.
So hopefully they should be down soon.
Okay, good.
I'm
Okay.
just going to put on some gloves.
All right. Okay.
And when we give medication, we have to do the checks again, kind of like I did this morning.
Oh, okay.
Okay.
Sure.
So, this is Joseph,
Yes.
correct?
Mm-hmm.
And what's his last name?
Rogers.
Okay.
Mm-hmm.
And date of birth?
11014.
Great. And his MRN number is 123456, which is what I have.
Okay.
This is acetaminophen,
Okay.
which we're going to give for his fever, 96 milligrams, which is 3 milliliters, in 3 milliliters.
Okay.
Okay? We're going to give it orally, and we're going to give it right now, so over here.
Oh, great.
And then after, we'll document it.
Okay.
Okay. Perfect. So if you could just sit him up.
Sit him up? Okay.
Yeah.
Okay, buddy.
All right. I'm just going to put it in the back of his cheek
Oh,
here.
good. Okay. Oh, good. He's taking good.
Yeah, he's doing a good job.
Yeah.
Okay. Perfect.
Okay.
Yeah.
Oh, great.
Good. Good.
All right.
All right. So, do you have any questions for me right now?
No, he's doing so much better. He's great. Yeah.
Great.
Yeah.
So, what's going to happen now is I'm going to leave you guys for a little bit.
Okay.
I'll be back in about 30 minutes just to reassess him, see how he's doing, see how everything's been. Hopefully, in that time, the doctors will come in and they can talk to you a little bit more about possibly feeding him if that's the route they want to go. So,
Okay.
they'll be in hopefully soon.
Okay.
In the meantime, if you need me, there's a call bell right there.
Okay.
And just press that, and I will be right in.
Okay.
Okay?
Thank you so much.
You're welcome. I'm just going to raise the side rail,
Okay. Great.
and I'll see you in a little bit.
Okay, thanks a lot.
All right,
It's
thank
really-
you.